The following video was recorded with permission of the patient. Kathryn is a 79-year-old who was referred to the virtual ward team by a GP-based paramedic due to experiencing symptoms caused by her significant drop in blood pressure on standing. Kathryn was known to have pre-existing heart conditions and a recent hospital admission for an unrelated reason. It was also identified that Kathryn was on blood thinning medication and therefore more increased risk of complications or hospital admission if she had a fall due to her postural hypertension. Day 1 on virtual ward, Kathryn was reviewed by the senior clinician. It was noted she had had one of her blood pressure medications stopped. However, the significant postural drop continued despite this medication change. Kathryn remained symptomatic and was unable to stand for 3 minutes while having her blood pressure checked. Therefore, the decision was made by the senior clinician to stop her water tablets. The clinician also created a plan of care for over the weekend to include daily sitting and standing blood pressures and daily weights to be taken by a nurse. Following the weekend and day 3 on virtual ward, Kathryn was reviewed again by a senior clinician and found to have a slight improvement in her blood pressure over the weekend. However, she remained symptomatic, so the clinician decided to continue to withhold her water tablet. By day 5, although Kathryn continued to have a postural drop, it was much improved and she was now asymptomatic. On day 8, Kathryn remained asymptomatic from her postural blood pressure drop, however, had started to become symptomatic from her heart failure. Therefore, the senior clinician restarted the water tablet furosemide at a dose of 40 milligrams once a day and arranged to check Kathryn's kidney function via a blood test at home. By day 13, Kathryn still remained asymptomatic from her postural drop. However, it was noted that she had an increasing difference in her blood pressure reading between sitting and standing. So to avoid her becoming symptomatic again, the water tablet furosemide dose was reduced to 20 milligrams once a day. This change was discussed with her local pharmacy team to ensure the dose was adjusted in her blister pack. By day 14, Kathryn was discharged from the virtual ward and referred to the neighbourhood advanced clinical practitioner team, who were able to follow her up within 14 days. Please now watch the following video featuring Kathryn herself discussing her experience of being a virtual ward patient and how this enabled her to avoid hospital admission whilst being supported at home.
Kathryn, can you just tell us a little bit about your experience of using the virtual ward, please?
Yes, I can. Well, when I first came out of hospital, I knew I wasn't right, and the lady from my doctors, I think she was a paramedic, came to check me out. And then she was really worried and said, your blood pressure's really going, it was about 50, dropping about 50 at that stage. And she said, you need to go back in hospital. And I just said, I don't want to go back in hospital, really. I've only just come out and I was in a month. So she said, so she suddenly said, oh, I know, because I've thought of something you can do. So she already must have known about you. Anyway, she then decided to, and I heard from you yourselves, and decided to come out to me. And it's been the best thing ever, because I didn't want to go back in, and there would have been no point for that, I didn't think, taking up a bed. And I hadn't heard of you virtual ward, and I didn't know what it meant. And then these nurses were coming out and doing all these obs and things with me, and kept an eye on it. And then they'd report back to virtual ward. And then they phoned me twice a day, which was brilliant, because it made me feel more safe, you know what I mean. And it was just great, absolutely. And then they adjusted tablets and did all they could to get it back to normal, you know, and it's done really well. And I can't thank them enough, and were wonderful. Been wonderful.
From your perspective?
None at all, and I mean that, honestly, none. No.
And what would you say to anyone else that was being offered the care in the virtual ward?
Definitely have it. Oh yeah, no doubt. I've told people already that I know.
Okay.
Yeah.
Okay, thank you.
Right.